coming up tonight, an outbreak. How cases of TB are popping up in America and how your neighborhood could be next. Please stay tuned for Navjot Kaur.
Hi, I'm the reporter Navjot Kaur, and we are at the Universal Hospital to find out more information regarding the TB outbreak. And I am standing outside of the patient's room, gloved, I have a mask on and the gown. Those are the precautions for airborne TB. And we are going to go inside and talk to the doctors and the nurses and find out more information regarding this disease. Hello, Doctor. I'm from News 10, and my name is Navjot, and I'll be recording the TB outbreak today.
Okay.
And what is your name?
I'm Dr. Tran.
And can you give us some history on how TB occurs in patients?
Okay, so TB is the leading cause of death. 1/3 of the population has it. It's very dangerous because many people get it from traveling from out of country. They go home, they don't even know they've contracted it. They want to take the test right away, and the problem is you have to wait 2 to 10 weeks after exposure. Mr. Sinclair, I just want to get a history of how you contracted TB.
Well, I visited my family in the Ukraine about 6 months ago, and I was around a lot of people.
Okay.
I guess they may have had the infection then, and I didn't know anything was wrong until I got home and I started losing all my energy and my appetite, and I started coughing a lot, and then there was like blood in it, and I knew something was wrong. Now I'm worried about my family and wondering if they have contracted it as well. I gotta take all these medications, and I can't smoke, and I just want to feel better.
We're at the nursing station, and I'm going to go ahead and interview the registered nurse assigned to the patient we had interviewed earlier. Hello, nurse. I'm the news reporter from News 10, and I just wanted some information. What are the signs and symptoms of TB?
Symptoms of TB depend on where in the body they are and TB bacteria growing. TB bacteria usually grow in the lungs. TB in the lungs may cause symptoms such as a bad cough that may last 3 weeks or longer, pain in the chest, coughing up blood, sputum, phlegm from deep inside the lungs. Pull out my notes. Other symptoms of active TB disease are weakness or fatigue, weight loss, no appetite, chills, fevers, sweating at night.
Here we are with the respiratory therapist, and she is going to go ahead and tell us about what happens inside the body once the TB is active.
Okay, once the bacteria is in the body will respond by making a capsule around it, like a wall around it, like a bubble, and that's what they call as tubercles. And this is a way of body to hold off the bacteria. And once conditions are good for the bacteria, that is, your immune system is weak, the bacteria is these tubercles are gonna pop up open and spread the bacteria to different parts of the body. And this spread could be by the bloodstream or the lymphatic system.
These were some of the basic precautions you and your loved ones can take to decrease the risk of getting TB. And if you do have TB, these precautions can help you stop the spread to friends and your loved ones.
Now this concludes our special announcement. Thank you, Navjot doctors and nurses, for your special report. We now go back to COPS, and before there is a small recap on tuberculosis.